When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Perry Precious. Executive Producer, James.
Hi, good morning, good afternoon, good evening. Thank you very much for joining us here on the Discovery Show. We say Yearn to Learn. So Michael Hedrington said that no one can take you down his or her path. And similarly, no one can lead somebody else down yours. All we can do is simply inspire others to listen and develop their intuition by listening and following others. It is based on this that we bring you the Discovery Show here on Facebook, Instagram, Twitter, and then on YouTube. The whole idea is to interview professionals in the diaspora and beyond who are making significant impact in the area of healthcare, politics, religion, academia, and what have you. Today, we are privileged to have another gentleman who is a PhD candidate at the Faculty of Health, University of Technology, Sydney, Australia. I mean, you will love to hear him, and we want you to sit back, relax, and enjoy this interview. We are privileged to have Mr. Bright Opoku Ahinkorah with us this morning, this afternoon, this evening. Bright, you're welcome to the Discovery Show.
Thank you very much, Precious.
Thank you. We are very grateful that you were able to make it finally. For people who may not know you, who is Bright? Tell us a bit about yourself.
Okay, thank you so much. So before I start, I would like to thank God for making this day a possibility for all of us. And I would also like to thank you and your team. I know it has been very difficult scheduling this interview, but finally we are here today. Right. So I really appreciate the opportunity you have given me. And to everybody that is listening to us today from everywhere, I would like to thank everybody. So my name is Bright Opoku Ahinkorah. And what I would say basically about myself is that I am a former student of the University of Cape Coast. So I did my undergraduate degree. I also did a master's degree. I did a postgraduate diploma in education degree, all in the same university. And I came to Australia to come and do my PhD. And I am in the final year now. So personally, I think briefly, this is all about me.
Okay. So if you can tell us briefly what your BSc and Masters was about in UCC.
Yeah, so in terms of BSc, I did population and health. And my Masters, I did health education. So these are the things that I did at the University of Cape Coast. And currently at the University of Technology, Sydney, I am doing my PhD in public health.
Brilliant. So I ask you specifically, we'll come to the PhD, but for the BSc and the Masters, we always want to educate people. There are people who may be watching, they have relatives who are yet to decide which program to pursue in the university. What would you say are the focus of both your MPhil and the BSc? And what are the job prospects for people who are watching if they have to decide?
Okay, so let me start with the BSc. So I did a BSc, or at that time it was a Bachelor of Arts degree, so BA in Population and Health. And BA in population and health basically is about knowing the health of a population, so understanding the health issues within a population. So we go in to study about how health affects people, where it comes from in terms of the epidemiological issues, where people get diseases from, how people can transfer diseases from people to one person to another, and then how people would be able to treat some of these disease conditions. We also try to understand what population issues are, how to understand the population, what are the factors that influence population growth, and what we can do to limit population growth. All these issues are studied in the course. That is some of the courses that are offered at the BA Population and Health Studies. And for somebody that is studying BA in Population and Health, that is Bachelor of Arts in Population and Health, I think in terms of in terms of job prospects, the person is really equipped with the knowledge and understanding of disease conditions within a population. So you are empowered to be able to enter into the health field and educate people really about what they can do in order to improve their health situations. You can also be in a sector where you can also educate people about population and health issues and influence policy in terms of population, in terms of health in any areas of your work. I wouldn't say there is a particular kind of job that is given to people that offer be in population and health, like somebody with a nursing or midwifery background. But with that one, when you are done, you are empowered to be able to educate people, to be able to understand people, and wherever you work, whether in the health field, whether in the population field, you will be able to offer any kind of support or any knowledge that people want in order to be able to have control over their health and to understand population issues. With the MPhil in health education is basically educating people to have control over their health. So I think in terms of population and health education, they are just related programs, and one builds on the other. So population and health gives you the basic understanding about health and population issues, and the health education empowers you to be able to offer the kind of intervention and education people need in order for them to have the control that they need over their health. So in terms of health education, I was in class with people that had nursing, midwifery background, and other health background, and these people were given the knowledge that they need in order to enhance their practice. But because I was not a nurse or midwife or any health professional at that time, I also
Yeah.
took that as an opportunity for me to build my knowledge in terms of health, to be able to even educate people who are not in the health field about health issues. So I think these are some of the things you are likely to um, be able to get through these programs, and you are able to get after you have gotten it through the program, you'll be able to offer the education that you need to people whenever you are given the opportunity to work in any health or population related organization.
Brilliant. So, of course, one of the key considerations for people choosing, a program of study has to do with job prospect. Would you therefore say that the programs you've just spoken about, it gives you access to almost every area of health, be it academia, research, practice, and all that? So, would you encourage people to go that path if they want to?
Exactly, because I think the purpose of education is not only to find you the job whilst you are doing the program. It is to empower you to be able to operate anywhere you find yourself. So when you are studying anything related to population health or health education, I think the knowledge that you acquire wherever you are put in, because I have friends who are working for NGOs like Mary Stopes, like PPAG, like Ghana AIDS Commission. All these are health related organizations, and they all did population and health or health education. And I feel that the knowledge that they gained in the course of their study will enhance them to be able to practice in that field of study. So you wouldn't say that, for instance, like a nurse or a midwife, when you are finished, you are going to work in a hospital. For population and health, yes, some of them work in hospitals, some of them work for NGOs, some of them work in population council, some of them work in other sectors that you can find yourself. But I think the most important thing is that you have gained the knowledge and expertise you need to be able to function properly based on the knowledge that you have gained from your studies.
Fantastic. Thank you very much. Viewers, thank you so much for joining us here on YouTube, Facebook, Instagram, and Twitter. Please subscribe to our channels. You can see the names just scrolling under the screen. So please subscribe to our channels and then share the link for us. You can also drop your comment. You can send in your questions and we'll ask Bright as much as possible. We are speaking to Mr. Bright Opoku Ahinkorah. He's a PhD candidate at the University of Technology, Sydney in Australia. And of course, he's amazing. He's doing amazingly well. So this is a conversation that will span 1 hour. We're going to talk about quite a whole lot of things. So please stick and stay with us. Because I would say you are a publisher general. You publish, widely. And let's talk a bit about research. Let's situate that. So I know some of your research interests are health, politics, and policy, maternal and child health, sexual violence and women empowerment, and adolescent sexual and reproductive health. I just want us to first of all focus on the adolescent sexual and reproductive health, which is also related to your PhD. Are you happy to talk about your PhD to us? Can you take that opportunity to educate us in that context for about 5 to 7 minutes here?
Yeah, okay. So thank you so much. I really love issues on adolescent reproductive health. Um, I have been an adolescent before, and I have gone through that stage where you have to move from childhood to adulthood. So that period for me is a very important period that is everybody has to take very important caution when the person gets to that stage because it can determine your future as an individual. And I grew up in a community where I saw adolescents going through a lot of health issues, especially for females. I saw adolescent females getting pregnant. Some of them, I hear stories of some of them committing abortions, some of them even dying in the process. So whilst I was doing my bachelor's degree, I had the intention that in the future I would want to study into some of these issues in order to understand them very well. So I did my master's, and as part of my MPhil thesis, I did something on adolescent pregnancy, where I
Okay.
talked to adolescent girls to understand some of the causes of adolescent pregnancy. And I realized that that is an area that is very, very important. So, as part of my PhD, I decided that if these are some of the causes of adolescent pregnancy, then what are some of the things we need to do in order to deal with the causes of adolescent pregnancy? And that ended me to study issues on policies and programs because I thought that policies and programs are issues that are implemented in order to deal with adolescent pregnancy. And adolescent pregnancy is one of the major issues when it comes to adolescent sexual and reproductive health. So for my PhD, I did something on policies and programs. And I looked at issues such as barriers to the implementation of these policies and programs, some of the facilitators to the implementation of these policies and programs. And interestingly, I think for adolescent pregnancy, especially in Ghana, that I looked at this particular issue, I think it is something that is very important because at the end of the day, when you talk to adolescent girls and they share their experiences as to how they got pregnant, a lot of them, for me, I think need a lot of education. And I think
Okay.
the education can only be done when we know what the problems are. And I think once we know the causes of adolescent pregnancy and we know the barriers to the implementation of policies and programs to some of these interventions that are aimed at reducing adolescent pregnancy, it will go a long way to deal with adolescent pregnancy and the general adolescent sexual and reproductive health issues because I think adolescent sexual and reproductive health issues like child marriages, issues like empowerment, issues like intimate partner violence, they all are issues that are connected to adolescent pregnancy, and they all also are issues that are related to adolescent sexual and reproductive health. So that has been my interest, that has been my focus, and that was a major part of my PhD because at the end of the day, I thought that if you are able to understand what causes adolescent pregnancy and why policies and programs that are intended to deal with adolescent pregnancy are not working, then we can find solutions to them. So that is how come I ended up studying or doing my PhD on issues on policies and programs on adolescent pregnancy. And I have tried as much as possible to understand this from different angles, through intimate partner violence, through child marriage, through women empowerment. And I think it has helped me to be able to understand adolescent sexual and reproductive health entirely, very broadly. And I think that is how come I am so much particular about these particular issues.
Thank you very much. It's we are happy to know where that interest came from, and beautifully spoken. We just want to know. I know, of course, it's a work in progress, so you may not be able to tell us entirely about what you found and all that. But the key highlight of your research, what has been the key causes of adolescent pregnancies? What are the impacts so far? And what can we do? If you can share one or two things for us, so that if there's someone watching who have adolescents at home, and they might know what to do in order to avert all these problems. Yeah. So can you share one or two things with us?
So I think that there are a lot of causes of adolescent pregnancy, even from the basic school level, secondary school level. We are talked about adolescent pregnancy, and a lot of people have fair knowledge. But from the research that I have done so far, I would say that there are three major causes of adolescent pregnancy that I can think of, and then these causes really also are three barriers that affect the implementation, because I feel that the implementation of every policy or program aimed at reducing something can be hindered through the causes of the issue. So I link the causes of adolescent pregnancy to three barriers. So the causes I would say are poverty, lack of sexuality education or comprehensive sexuality education, and negative sociocultural norms. These are the three that I will talk about. And I also discovered these as three barriers to the implementation of policies and programs aimed at reducing adolescent pregnancy. I know we all know that how the country, for instance, Ghana and other developing countries go through a lot of poverty issues. And these are not distributed across the country fairly. So when you go to the rural areas, poverty is very high. And then when you go to the urban areas, it's very low. And that is the same way adolescent pregnancy is distributed in a lot of low and middle income countries like Ghana, where adolescent pregnancy is high in the rural areas and low in the urban areas. I feel that a lot of parents that go through a lot of poverty issues, socio-economic challenges, end up having children or adolescent girls ending up in relationships that end in pregnancy, or ending up in relationships that engage in activities that could lead to pregnancy. Because at the end of the day, I feel that if the parent is not able to provide the basic resources or the basic needs of the adolescent girl, of course, we live in a society where the adolescent girl also wants to make ends meet. The person needs certain things. So if the things are not provided, then the only means of getting is to enter into a relationship with a man that can provide such resources for the person. And of course, we know that it is give and take. So no man is going to give you money or resources for free without demanding for sex. And some of them, these men demand for sex. And a lot of the instances, a lot of the sex are unprotected sex, which end in pregnancy. So I think poverty is a major issue, because of poverty, they lack a lot of the resources that they need, and some of them are not even able to go to school in order for them to be empowered or educated about issues that would prevent adolescent pregnancy. I also feel that we live in a society where there is frowning on issues on comprehensive sexuality education. I remember there was a time that the country wanted to bring a policy on comprehensive sexuality education, and then make it mandatory that it has to be taught in schools. And it became an issue in Ghana. And I think this is a global issue, because if you look at some of the developed countries, The comprehensive sexuality education is something that people educate individuals, especially adolescents, about. But it's not easy for Ghana as a country or other low and middle income countries to accept this. The fact is that I feel that the fact that you are educating an adolescent about issues on reproductive health does not make the person promiscuous. Research does not show that. And I feel that it has come to a time where parents should get the confidence to be able to educate the adolescent girls, especially on issues about sexual and reproductive health, because it is better for them to know than for them to be naive about some of these issues. Because when they are given the education, it empowers them to be able to take decisions related to their sexual and reproductive health, which includes when to say no to sex, what to do even when you're having sex, how to even use contraceptives and all that. These are things that the adolescents need to know. But the lack of comprehensive sexuality education is an issue and it's a challenge in a country like Ghana. And for me, I think that is one of the issues that is making adolescent pregnancy go on the rise. And it is one of the barriers to the implementation of policies and programs. The last thing that I will talk about, which is local context cost and as well as a barrier, is the sociocultural norms, where we live in a society where people see late childbearing as a sign of barrenness or inability to give birth or something. So when you go to some of the communities in Ghana, you realize that some of the adolescents want to just get pregnant in order to please society, because their friends will even laugh at them when they get to a certain stage and they have not given birth. In my research, I found that even parents and some of the adolescents, they laugh at each other, because when you get to 30 years and you have not given birth, then when you are in the community, they seem to laugh at you because they think that you are not able to give birth compared to somebody who is 18 or 17 and has been able to give birth. So they see pleasure in giving birth, and then that encourages some of them to engage in behaviors, for me, risky sexual behaviors that put them at risk of adolescent pregnancy. So for me, these are the three causes of adolescent pregnancy that I would always talk about.
Fantastic. Thank you very much. You spoke about the policy, you spoke about the comprehensive sexuality education, which I was going to talk about, ask you about policies you think needs to be implemented or amended. But of course, you've spoken about that. So thank you very much for taking time to talk about that very comprehensively. I think these are social issues of, great impact that usually we do not talk about. Again, on health policy and health politics and policy. So I'm just going to probe further. So I know you are from a non-nursing background, but of course, you have taught in the nursing training college before.
Yeah.
And as I would say, you are somehow affiliated to nurses as well. So I would like to ask you one or two questions in that regard. So currently, one of the challenges we are facing in Ghana is unemployment when it comes to nurses and midwives. And it's not as if we have enough. That is not the situation. There's still shortage of these healthcare professionals in these hospitals. Recently, the government, the current government actually did say that they are going to recruit secondary school leavers or graduates, 5,000 of them, and they are going to be placed in community health planning services, what we call CHIPS compounds. And beyond that, we have over 41,000 as of 2019 and 2020. We had over 41,000 graduates, the diploma and degree nurses who are home unemployed. Yet we are going to employ 5,000 graduates from secondary school. As someone who is into health politics and policy, what do you think about this?
Okay, so that is a very, very important issue and thank you for giving me the opportunity to share my thoughts on this. I am not really into politics, but as to whether this is politics or not, this is a health issue that we are
Absolutely.
really interested in. And I think
Rightly so.
somebody who is also experienced in terms of policies, I think anything that is geared towards improving the health of individuals through policies implementation, I think I have the expertise to share my opinion. This is my opinion about this. I think that The idea of trying to train secondary school leavers or those who have completed secondary school in order to help the health sector through the CHIPS compound initiative, I think it has its both bad and the good aspect. I wouldn't say it is a bad idea. I wouldn't also say it is a good idea. I would like to talk about some of the bad issues and then the good issues in relation to this. For me, I think it can be bad because it depends on one, how long is the training going to be? And then which people are they going to recruit? Are they people from the science background or from what background? Apart from that, imagine somebody who has been trained in the nursing profession, even at the diploma level for 3 years. And compared to somebody who has just finished secondary school, and you are going to give the person training for like 6 months or even 1 year.
No,
Is that
few weeks.
sorry?
Very few weeks, not even up to 2 months.
Exactly. So even if it is 6 months, let's assume it is 6 months. Do we think that we can put the health of individuals at stake by employing people who have just gotten training for just 6 months to be operating on people's health? Because for me, we don't joke with health. And even when you go to developed countries, I'm speaking about Australia because that is where I am.
Okay.
You can have a nursing background from Ghana or even any that other country. When you come to Australia, it is not easy for you to go into their system. Even when you have been trained and you have practiced in Ghana for about 10 years, you still have to be trained in their sector for some years. Sometimes you have to go to their education system because the practice is different. You know what I mean? So somebody that has a secondary school background and has not gone to a nursing or midwifery school or something, if you want to train the person for like 6 months and then put the person in the CHIPS compound, of course, the idea is to offer the service to people. But we are dealing with people that are dealing with battling with health issues, already going through a lot of psychological and mental health issues. So when you put somebody there with little to not so much experience in terms of education background in the health field, I think we are putting the country's health at stake and the individuals in the country at stake. Because whatever a mistake that is done in the health sector, I think can go a long way to have a lot of grave impact on the health of individuals. That for me can be the bad aspect. But for the good aspect, I think it can also help to relieve the pressure and the lack of for me, I think the lack of professionals at the rural communities. That is where the CHIPS compound are mostly located. I think one of the issues you talked about the unemployment in the health field. I understand the unemployment, but I also feel that some of the nurses themselves, those that have been trained, a lot of them also don't want to be posted to this CHIPS compound to work there. That is for me, that is the idea that I have. I am married to a midwife, and then sometimes we talk about some of these issues. She has friends that have been posted to some of these places, and some of them don't want to go there. So these are also areas that really need a lot of expertise because we all understand that the kind of health challenges our communities face is not the same as those that are in urban areas. So for me, even if I were the health minister of Ghana, it is only the experienced ones. I would put the experienced one in the CHIPS compound compared to the major hospitals, because when you go to the rural community, they are facing a lot of challenges with their lack of resources and a lot of issues, and they need experienced people. But you go to the CHIPS compound and it is only the certificate nurses that are offering services. Some of them are doctors, some of them are pharmacists, some of them are doing operations and all that, which shouldn't be the case. But in order for us to curb this unemployment, I think the government should put a lot of incentives in the rural communities so as to motivate some of these nurses that are unemployed and they would want to go there. Because I don't think they are just there because they don't want to be employed. But there could be incentives that are in the rural communities in the CHIPS compound that will motivate them to be there. And of course, those that are unemployed, I think it is also important for us to look at them instead of looking at SSS graduate, because it is better for us to deal with people who have received intensive education, about 3 or 4 years, for them to be able to work on the health sector instead of giving training to SS graduates for like 6 months to put the country's health at stake.
Thank you very much. We've been speaking to Mr. Bright Opoku Ahinkorah. He's a PhD candidate at the University of Technology, Sydney, in Australia. He's already told us a bit about himself. So, thanks very much for being with us, Bright. Viewers, please drop your comment, send in your questions. We'll definitely read that to Bright if necessary. And please don't forget to hit the subscription button, like, comments, share it with other people, and let's learn together. Please listen to this.
Meet Mr. X, an unhappy businessman who has been waiting for days for his goods to be delivered. Unlike Mr. X, business is booming for Mr. K because of his efficient partnership with Hembeck 60 Hub, also known as HB 60 Hub. We are an online platform that sources for goods from across the globe. We only pull high quality standard products from anywhere in the world and ship them right to your doorstep. Be it watches, clothes, bags, and many others. Do get in touch by contacting us on www.henbeckagency.myshopify.com, or you can call us on +233 546 022 952 or hembeckTravels@gmail.com. Hembeck 60, truly a world of endless possibilities.
Thank you for sticking and staying with us here on the Discovery Show. Here we say yearn to learn. We are learning together. We have been encouraged by the stories of the guests we interview. We get to know a bit about their journeys, where they are, so you can be motivated. And if you want to go their path, we can keep you in touch with them so that you can also achieve whatever you want to achieve. My name is Precious Adadidiodu, your host, ably produced by Mr. James Kwabena Opon. And we've been speaking to Mr. Bright Opoku Ahinkorah, who is a PhD candidate at the University of Technology, Sydney, in Australia. So, Bright, of course, if you know anyone or if you are watching yourself and you want to deal in footwears, clothes, watches, bags, and books, and you want them to be sourced from the best of companies around the world and sent to you or shipped to you wherever you are across the world, please contact Henbeck 60 Hub. Henbeck is HENBECK 60 Hub. On Facebook, you can send them a Facebook messenger, or you can send them a message on +233 546 022 952, or you can just send them an email at hembeckTravels@gmail.com, and they will help you to source footwears, clothes, watches, bags, and books. Or if you have bought them yourself, they are able to ship them to whichever part of the world you want them to send it to. So when you say Henbeck 60 Hub, you say truly a world of endless possibilities. Thank you very much for sticking and staying with us. So Brian, let's talk a bit about your PhD. You did your MPhil and BSc in Ghana, but of course PhD in Australia, and I want to believe it's on scholarship. Can you take about 10 minutes to go step by step? How did you even start in the first place after your MPhil? How did you start the process, or during your MPhil? How did you start the process towards a PhD? What are the winning tips for you, really? And also, how did you secure the scholarship? We want people watching who may want to go the path of Australia to know the way forward. So please take about 10 minutes to take us through the whole process.
Okay, thank you so much. So I think for me, yes, gaining scholarship to come and study here, it wasn't really easy. And I think it has not been easy for everybody that has eventually made it in terms of gaining scholarships to study elsewhere in other countries. Sometimes I think it takes prayer, hard work, and determination in order for you to be able to be successful in such a journey, because I think you have to put in a lot of applications. A lot of rejections will come, but you have to persevere and understand that that is what you are focused on, and that is what you want to do. When I finished my MPhil, my idea was to do a PhD. So everything was on my mind. So my focus was on PhD. I started applications. I started Commonwealth Shared Scholarship UK. I did some applications uh, to the US, and I think Precious got the Commonwealth Shared Scholarship, and that is
That's
where
right.
he is on. And I tried. I did not get. I did about a number of schools I did not get. I applied to other countries, Canada. I did applications there. I did not get. So I had the opportunity. Australia was not a country that I had heard about so much because my past studying, a lot of the countries that I see people studying had been UK, US, Germany, Canada, and all that. But my junior brother had the opportunity to study his PhD. So he got a scholarship to come
Okay.
and do engineering in Australia. So he got that a year before me. So because I was not getting and I still wanted to do a PhD, I started my PhD. I started to do a PhD in Ghana. So I did a first semester PhD in health promotion, still at the
Wow.
University of Cape Coast. So because my focus has been to travel to go and do a PhD, whilst I was still doing my PhD, what I had started, I still tried to put in some applications, even when I was studying. So thanks be to God, in 2019, I did the application to a number of schools in Australia. And then I got admissions and scholarship to about 3 of them. So it was
Okay.
left me for me to choose which one to go. And I had in contact with a senior of mine that was also in the same university at the University of Technology, Sydney. He also graduated from the University of Cape Coast. So I got in touch with him, and then he encouraged me to come to the University of Technology, Sydney. So I think that it is through connections, but I think in order for you to get this, you have to put in some effort. I wouldn't say it was easy for me to get a scholarship. I knew that before I can get a scholarship, I need to do certain things. Apart from the fact that I have a degree or master's degree, there were certain things that I needed to do. And then some of my friends encouraged me to start publication. So even before applied for the scholarship, I had started to write 1 or 2 publications because I read about Australia, and then I heard that one of the ways in order for you, one of the criteria for you to get a scholarship in Australia is to have some research experience. So I had to try to connect with people that had research experience, work for some research related organizations back in Ghana, and try to write 1 or 2 papers in terms of publication. So I would like to also thank Dr. Kwamana Sechi Dixon. He introduced me into publication. So I started publishing with him. I had about 3 papers as at the time of my application. And I put in the application with these 3 research publications and then the research experience that I had gained working for 2 research organizations in Ghana. And then with my background in terms of my PhD, sorry, in terms of my MPhil, and then my credits, I would say credits, and then the qualification, my certificates, and then my other things that are related to my education. I think I had to just put in the application, and then I had the 3 scholarships, and then I had to choose between one of them. So I think getting a scholarship here in Australia, I wouldn't say it is all about publications, but publication, if you have publication, it is a plus. But you need to get experience in the field in which you are working. So, for instance, if you are a nurse or a midwife, you need to gain some working experience within your sector. If you are into education, you have to be teaching for some time in order to get that teaching experience. If you are into maybe an industry, you need to get an industry experience because the experience has to be related to the course or the program in which you are going to do. Apart from some of these experiences and other things, I think you also need to develop a very strong proposal because without a strong proposal, you are not even going to get a supervisor not to talk about getting a scholarship, because for Australia, the pathway is that you need to look for a program of interest, search for supervisors that are into that program, put in your intention to study through email. So you contact the supervisors, you have to attach your resume, or what we call the CV, into the as part of the email, and then you put in your proposal. So any supervisor that is interested in your proposal and they sees your CV as very strong will also express the desire to supervise you and give you the go ahead to do what? To do the application. So once you have a strong proposal and then your CV shows that you have a lot of maybe great academic records, I think it is easy for you to chance on any scholarship opportunity that are available on the university's website. And I think it is important for us to read the universities' criteria in terms of selection, because every university, even in Australia, some of the universities they expect us to write English proficiency tests, but some of them they don't expect us to write. So before you even get into contact with the university, you need to know whether English proficiency is a requirement or not, and then what you need in order for you to get a scholarship. For some of them, you don't need so much of a research publication, but some of them you need a lot of research publication. And I must say that now it has been very, very competitive, because as at the time I was applying about 4 years ago, even if you have 2 or 3 publications and then you have research experience, you can easily get a scholarship. But now I have friends that have over 20 publications, they have research experience or work experience, but they are still not getting a scholarship. That means that there are people that have more experience than you. So as the time is going on, a lot of people are gaining a lot of experience. So if you really want to apply now, then you need to do more than what your those who are already studying or those who have already started the journey got what the means in which they got, because you need to really improve upon your expertise in that area in order to get that experience. But I really love Australia, and I think it is very easy for you to get a scholarship if you really have all these things that I am talking about. You are really able to align your PhD to what you are going to study. And I think that once you develop a strong proposal and you get good supervisors, you'll be able to really get a scholarship to study in Australia.
Interesting. Thank you very much, Bright. Let's try to dissect it a little bit. Of course, you've said a lot of things. So you did mention that for now you need a lot of publication. What do you classify as a lot for someone who is a beginner or who want to apply for a PhD now? What would you say should be the minimum or the range of publication they should be looking at to improve their chances?
Okay, so I think that I wouldn't talk about a number, because the number depends on your capacity. Because at the end of the day, I wouldn't say maybe 10 or 20, because somebody cannot get the 10 or the 20. But I think that one advice I would give to anybody that really wants to do a PhD is that right from the bachelor's degree, if possible, you have to start building your research credibilities, research potential. If you want to publish, start from the bachelor's degree. Because I started my publication from that. I started even late, because at the bachelor's degree, I didn't have any publication. I only started doing it when I was doing my master's. So I asked myself that if I had started when I was doing my bachelor's degree, I would have gotten more. So somebody contacted me just a few days ago, and he said that he's still doing his master's. Then I said, yes, as you have started, if you really want to come to Australia, apart from your work experience and then whatever experience that you have and your academic records, I would encourage you to get a few publications. And the journey starts now. You need to start. So I think that in terms of the number, I think as many as you can.
So I think on the flip side, or if I flip the question, what I mean is that what minimum publication will you recommend for people? So what I mean is that, do you think if I have 2 publications and I'm putting an application, I have a chance at all? Because I once had someone who said he was applying to a school, I've forgotten the country anyway, and they needed at least 3 publications. He had 2, and he was working assiduously towards getting another in addition. So what would you recommend to be the minimum they should look at least?
Okay, so if you want me to talk about number, I think at least you should have like 5. For me, I think 5 should be the minimum. And
Okay,
I don't want to really stress on the number because,
I get
for
you.
instance, if 10 people are applying and then
Yeah.
you have 5, and then the remaining 9, some of them have 8, somebody has 10, some of them have 15. They look at how competitive will you be with your 5. So
Certainly.
for me, as many as you can, because it doesn't matter if you have 20, you can use that to apply. But that does not mean that it is only publications that you need. But I think it is an addition because as part of the some of the university requirement here in Australia, you have to upload your publications as part of the application for the scholarship. It is a requirement. And apart from that, you have to also show that you have work experience and all that. So I say that if you don't have publications, it doesn't mean you cannot get a scholarship to study in Australia. But if you have it, you stand a greater chance of getting it than somebody who doesn't have it at all. So I think a minimum of 5 for me should be fine. And I think that should be something that people should really take very serious.
Okay, brilliant. Now, let's talk about. I always want us to draw the stage when I interview people from different countries. Here in the UK, in most cases, the scholarships usually, in most cases, not all the time, goes with the admission. So, if you are sorry, separate from the admission. So, for example, if you get admission in a university, you might have to apply for an external funding, like maybe Commonwealth, anyway, which has been scrapped for Ghana. Ghana is no more part of the PhD when it comes to Commonwealth for now. But what I mean is that in most cases, the funding is either external or within the same university, within the department or school, but you need to apply that separately from the admission process. In US, in most cases, the scholarship is together with the admission. So if you are getting that, you usually get it together. What is the situation in Australia? Do you usually have the scholarships coming with the admission, or you need to apply for them separately?
Yes, so I think for Australia, in most instances, the scholarships are tied to the admission.
Okay.
So whenever you are applying for a program, you indicate the kind of scholarship you also have the intention of applying. So they do the assessment of your application to the university together with the scholarship you have applied for. It is only when you are not able to get a scholarship but you gain admission, that you can also apply for a scholarship separately. So when you are applying, you have the opportunity to indicate, okay, these are the scholarships I want to apply. Then they will assess you based on the scholarship criteria. If you meet it, they give you the scholarship together with the admission. If you don't meet it, they can give you the scholarship. They can give you the admission without the scholarship. And then it is up to you to apply for a different scholarship in order for you to maybe get some money or to waive your fees or something. So in most instances, everything is tied together as part of the application.
Brilliant. Did you say for people applying for PhD, they need a proposal? Is that right?
Yeah, they need a proposal.
In almost all the universities in Australia. Is
Yes,
that
in
right?
almost all the universities, you need a research proposal.
Okay, brilliant. And can I also ask, when it comes to you talk about the fact that you needed to draw on your experiences, work experience, your MPhil and other things in order to be able to put in application. What are some of the winning tips? What would you say people should concentrate on when they are writing their personal statements, their application? What should be the focus? And I have personally said on this platform over and over again that the era where people highlight that I'm the breadwinner of my family, I'm from a poor background, and they keep talking about that for maybe about 2 paragraphs, is over. You need to find a better story to tell. So that is just what I have been talking about. But for you, what would you say are some of the winning tips for you in writing your personal statement, your scholarship application, and every other thing you did?
Yeah, I think that the the issue is that you are going to do a PhD and it is an academic journey. So for me, whether it is about personal statement or it is about your application, the focus should be on your education credentials. So I would talk about the fact that I had a first class for my bachelor's degree. This were this was the GPA, or yes, the CGPA that I had. For the masters, this was the CGPA that I had. These were some of the courses that I did. This was some of the research related activities that I engaged in as part of my studies. These are some of the research courses that I undertook. Because it is not really about social activities that gives you the platform to be talking about your family, so much about them. It is about your academic journey and how you have been able to sail through the journey by outlining your excellence throughout the journey. And I think that when you are writing some of these things, your focus should be on the achievements you have been able to get throughout the journey, some of the awards that you have been able to get, if any, some of the activities you have been able to participate in. Of course, if we have been able to also contribute outside the academic career, like maybe instead of student leadership, I think it is also an opportunity for you to talk about them, because Australia also believes in student leadership. So if you are able to engage the society through your student leadership, I think in writing some of these personal statements, you can bring them in. And I am sure that you have a higher chance of winning some of these scholarships.
Fantastic. One of the greatest barriers to graduate school application has to do with application fees. Is that the situation in Australia? Do we have application fees for most of these PhDs or none?
Um, I might have forgotten, but I think as at the time that I was applying, it's not all these universities that require application fee, but
Okay.
those that required application fee, the application fee is very minimal, like maybe 100 Australian dollar, which is not really so much money, even in Ghana. So it's not all the schools that require application fee, but those that require, I think there might be few, but I don't think I paid any application fee, so I wouldn't be able to say, I wouldn't say that there's application fee or not, but I think some
Okay.
of the schools may charge something small, but I don't think there's application fee. Yeah.
Okay, brilliant. Of course, viewers, you will bear with me that the journey hasn't been all that smooth for Brian. He did mention he even started a PhD in Ghana, which he had to terminate to take up this one. So, one of the reasons for our interviews here is to encourage you that sometimes from afar you might think that people have had it all rosy. They just applied once and they had it. But like he said, he applied for Commonwealth severally, but he didn't get it. So if you're watching, you've put in applications and it's not working, please do not lose hope. Keep persevering, and definitely you'll be able to achieve what you have to achieve. That's one of the reasons why we do these interviews. And we want to believe that by the end of this interview, you'll be encouraged by Bride's story. So, Bride, I just want to find out from you. Of course, from what you've said so far, I would like to assume that you haven't been to UK, Canada, US, and all that. But with when it comes to conversations with colleagues or friends who are in these areas, comparatively to studying for a PhD in Australia, how is it like? Do you think it is more of a friendly environment? I always say that UK system is very, very busy and full of pressure. I always tell people. So if there's someone watching, I mean, based on conversations you've had, sometimes people have multiple offers from different countries and they are thinking about how do I decide on this and that. Do you have any knowledge from, I mean, grapevine conversations that you want to base on that situate the situation in Australia to help people to make such decisions? How is life in Australia generally?
Um, I really love Australia, and I am very glad coming here. I have colleagues who are in the UK, Canada, and then the US.
All
I
right.
have not really read so much about the education system there, but I think Australia is a place where, even though there is pressure, but it is a relaxed academic environment.
All
you
right.
you are free to really go through the academic journey at the pace that you want, and
Okay.
nobody is really putting so much pressure on you. um, Even as a PhD candidate, you are free to maybe even decide this is how long I want to finish my PhD, even though there is a timeline. But if you are not able to finish within the timeline, they give you a grace period for you to finish. And you have the liberty to go at the pace that you want. Nobody is pressuring you to do any thing. But the focus is that at the end of the day, you have to be so much focused on your PhD and make sure that you are finishing on time. I think some of the universities, I don't know of US, Canada, and the UK, but I think some of the universities do coursework as part of their PhD. But for Australia, there is no coursework. So you don't do any coursework. So the moment you come, you are starting with your PhD right from the word go. So by the time the 3 years is up, or the 3.5 years is up, or even 4 years, I know a lot of people would have even finished long ago. So I don't think there is so much pressure, because your PhD is something you would want to do. You have so much knowledge about it. So the moment you enter into it, you know what you are doing, and I think you will be able to finish on time.
Brilliant, brilliant. Thank you very much, Bright. So let's talk a bit about family. Of course, it's something we cannot throw away. Sometimes people move into different countries and they want to move their families with them. And also, whilst people are about completing or even during the program, they are thinking about the next step. Do I stay? Do I go back to my home country and all that? I want you to combine two things. How easy is it to move family to Australia? If you have any knowledge of that, if you can share with us. And also, how easy is it for people who are already pursuing master's, PhD, to find side jobs and even full-time jobs after completion?
Okay, so in terms of family, I think Australia, every student, so whenever you are on a student scholarship, the scholarship conditions are such that you are able to bring your immediate family with you. Immediate family means that your wife and then your children. So I think that is an opportunity for every person on a student visa. So that includes even those who are doing their bachelor's, those who are doing their master by coursework, those who are doing their master's by research, and PhD candidate. You can even add the person on, your family on, when you are doing your application for the visa, or you can come and then bring the person on. Personally, I got married while doing my PhD. But when I got married, I just put in the application, the visa processes for my wife, and then thanks be to God, they granted her the visa, and then she arrived in Australia 2 weeks ago. And I'm happy. I am very happy she has joined me finally. But the path to getting her the visa was not very difficult. You only have to meet the criteria, just put in the application. You can bring your children, and then I know people who just came to Australia and then within 2 weeks or 3 weeks, they are granted the visa for their spouses and then their children to come and join them. So I think for Australia, you can easily bring your family. And I think in terms of job prospects.
Let me just ask a question here before you move to the job.
Okay.
Is there any limitation to the number of children you can bring?
No. There is no limitation. If you have about 20 children and you want to bring all of them here, you can bring all of them here. But I think maybe in terms of your wife, I don't know. But those who are married to 2 wives and all that, I don't know whether you can bring both of them. But I think I am not married to 2, so I don't know about that aspect. But I think I know people that have 3 or 4 children, and all of them have come to Australia to come and join their husbands and then their maybe family, something like that.
Okay, you did mention that if you are married and you have children and all that, you can add the application to yours during the visa application process. Just for purpose of clarity, do this if your institution or your funders get to know you have family, do they add any extra money to cater for their application as well, or that will solely be on you?
No, you are going to pay for their application. So I think what happens is that the application for the visa is such that when you are applying, you indicate whether you are married or not, and then you have children or not. If you are married, you indicate your wife's details and all that. If you have children, you indicate their details and all that, and you apply for separate visas for them. So you are going to pay for the visa fees and all that. But I also know that one of the advantages also is that when you bring your children here and they attend public schools here in Australia, you don't pay any fees. I don't know for other countries, but here that is one of the incentives. And when you bring your wife here, the person can work just as you. So if we are given the opportunity to work 40 hours a week or a fortnight, your wife is also able to work for that minimum number of hours.
Okay. I mean, for some scholarships, they consider to give a stipend, a little booster to your stipend if you have children. So let's say if you have one, they decide to add a particular amount. I'm asking all this to, I mean, to bring to bear the details. But of course, if you are not abreast with that, then of course we can
Yeah.
get that information later and put that out here.
Yeah.
So if you could just, oh, sorry, you wanted to take that, isn't it?
Yeah, so I think for Australia, I don't think they give you extra money. Your stipend is the same as what you will get,
Okay.
whether you have children or you don't have children. So it is up to you to declare that you are able to cater for them with your scholarship and any other job that you will get whilst doing your studies.
Okay, so let's talk about the job now. During the studies and after studies, how easy is it? And the visa issues. Is it easy to get companies to sponsor your visa for you to stay and work? What is it? Yeah.
Yeah, so once you are studying, you can easily get jobs. There are a lot of jobs, but it depends on what you want to do and which one is available. And of
Okay.
course, it also depends on your experience. Because I don't know of other countries, but for Australia, um, your experience in your home country may not be enough to secure you the kind of job, your dream job, if I should put it that way, your dream job here in Australia. So you have to start somewhere and
Right.
work maybe for some of the companies, and then I think you can get the opportunity to work for a bigger company whilst you are still studying. And when you finish, I think for PhD students, when you are done, you have up to 4 years postgraduate working visa, what we call graduate working visa. So you have up to 4 years, and then for that visa, you can be sponsored by any company if you are employed after PhD, or you can use that visa to look for any other jobs that you want to do within that 4 year period. So that is
Okay.
one pathway. Another pathway is that depending on the program that you study, for instance, if you study nursing, midwifery, or any other health related program, or you do engineering, there's an opportunity for you to be sponsored by a state or
Okay.
even be sponsored by the government. They need some of these people, and then you can even have the opportunity to become a permanent resident. So you can apply for a permanent resident visa if you do programs like nursing, midwifery, engineering, and any other. So they have a list. So you just have to make sure that your program of study is in the list, and then you put in application, and it is graded based on points. So if you are able to get the minimum points that is required, you can be given a permanent resident visa to live and work here permanently after school.
Brilliant. So of course, finding job is not a problem at all. And even if you don't get one immediately, you have 4 years to search for a job, isn't it?
Exactly. Exactly.
And does that cover both masters and PhD or only for PhD?
So PhD is 4 years, masters is 2 years. So you have up to 4 years. That is for PhD. Masters is 2 years, and I think diploma and the bachelor's degree is, I think, now 18 months or something. Yeah.
Okay, brilliant. I mean, viewers, we ask some of these things together with the journey for application and all that, simply because a lot of factors are considered when taking decisions. I mean, migrating and all that, and family is very central to our life. So if you have family and you want to move, all these considerations will come in. So we need to know so that if you have to decide to move to Australia, at least you have a fair idea of what the situation is for you to make a good decision. So thank you very much, Bride, for telling us a bit more. I know we are just a little bit over our time, but of course, like I said from the beginning, I call you the publisher general because, of course, I'm not sure if you know exactly how many publications you have now, but a huge congratulations to you. I must say that is a great inspiration, and especially hearing from the point that when you were putting in your PhD application, you had just about 3 publications. And now I'm sure you are just getting closer to over 300, or perhaps I'm even underestimated. It tells you that, I mean, over a space of, or between 2019 and now, you've done massively well, and that is the sort of encouragement I take from, I mean, amongst the many other things I've learned, that we start from somewhere, but you need to keep persevering, start working with the right people, and of course you'll be able to get there. So you did tell us a bit about how it all started, but what's the secret really for you, and what are some of the tips you share with people who want to go into the research business? Where did they start from in the first place?
Yeah, so I think just as I mentioned, the publication journey started from somewhere, but I always thank God for giving me the energy and then the ideas to be able to focus on publishing, because I really like to publish. And I think it has been this far because of prayer, hard work, and the determination, as I always say. Um, in terms of publication, I think one of the keys for you to be able to have a lot of publication is to be focused, because we live in a society where when you are doing certain things, you have a lot of, I would say, a lot of problems and challenges that are coming your way, a lot of negativities and a lot of things. But you have to remain focused and know that this is what you want to do. Apart from that, for publication, in order for you to be successful, you need a lot of collaborations. And I have to thank all the people I have collaborated with, those that are senior member professors, doctors, and especially Abdulaziz Seidu, who is currently at James Cook University. He has been my collaborator from day one. So I mentored him into publication in
Wow.
2019. So I brought him into publication. So his first publication was a collaboration I did with him. And then we remained focused because that was what we loved doing. And even though COVID has not really helped a lot of people, and I would say that a lot of people have died from COVID, and then may their
Mm,
souls rest in peace. But I think COVID brought me that opportunity, gave me the opportunity to really work hard in terms of publication, because it was during COVID that we took the opportunity for not going anywhere. We are in the room and we have nowhere to go, and we have to be publishing a lot. We have to just be publishing and writing a lot of things. But I think the key is collaboration. You cannot do everything on your own. You have to seek people that are in that area and try to get their ideas. And I think don't also really focus so much about trying to publish with people that have already made it in life, people that
mm,
have so many publications already. Try to bring
mm,
in the young one, because the young ones really have a lot of ideas. I have a lot of young people that we are mentoring in our team. And I think
mm,
some of these people have a lot of experience that we are tapping into. And they have all
mm,
helped us to come this far. I would like to
okay.
also thank all the young people that we are mentoring, because they have helped us to succeed in getting the number of publications that you can see that I have as at now. But everything has been really about prayer, hard work, and determination, I must say.
Wow. No, I'm encouraged. Of course, I know Aziz also has a lot of publication, but I'm quite excited and very motivated from this standpoint that you brought him closer, and look at where he is now. So it comes back to what you've said, remaining focused, just getting connected to people who have the same passion, energy, and the drive to also do the same thing. So, I mean, well done. Of course, and like you said, you are mentoring quite a lot of people. I know a few of them. I know you have a research console. You want to talk a bit about that? If there are people who want to be mentored by you and your team, how did they get in touch with you? And for the research console, what is the criteria? What is the focus? How do people get in there to be helped? And
Okay.
especially, for example, if you have someone, I have had few people who've just completed their BSc or they are about completing, and they say, look, I want to publish. Really, where do they start from? And if they have to come to your console, where do they fit?
Okay, so let me start by saying this. We started this research consult, that is REMS Consults Limited. Now it has been registered in Ghana, so it is fully an operational kind of consult. We started it way back.
Rems was a full meaning.
REMS consult, research made simple. So that is the
Hey,
shortcut. Research made
okay.
simple. So that is the name of our research consult. So REMS consult
Okay.
limited. And then we started it. I started that with Aziz. I was doing it before I even met Aziz. And then I saw
Okay.
that he had a lot of knowledge. That is why I said that whenever you are doing some of this, is try to bring people that are not experienced more than you in the equation. So I brought him in, and then the two of us started to do it. We started by helping students in terms of writing their research work, in terms of their project work, helping them with analysis, educating them, going to the nursing training. So I got the opportunity to teach at the nursing training basically because I help some of the students to understand their research and all that. And
Okay.
then I got that opportunity. So we established this REMS consult. And then when I came here in Australia, I realized that there are a lot of students that are really very good, but they are not getting any people to mentor them. We don't only mentor in terms of publication, we give them training in terms of research in general, in order to empower them for them to be able to understand what research is and to be able to use that whenever they get the opportunity to. And for REMS Consult, if we want to be part of it, every year we advertise to do recruitment because we have quite a number of people. And then
Okay.
for now, we are mentoring about 17 people. We have 7 ladies, and then we have 10 gentlemen. What
Okay.
we are doing is that we are trying to empower some of these people. And I must say that through this particular project, two of our mentees, including even Abdulaziz, also got the opportunity to come to Australia through the publications and this mentorship project. I know of Collins, who is also at James Cook University, that got a scholarship because he had publications and he has been mentored to be able to build his research criteria. There's one other guy who is in the US, James, who has also gotten admissions and scholarship through this mentorship. It is not very difficult. We just post it in our Facebook and then you apply. We do interview, we do our selection criteria. And once we know that you have the expertise and then you are able to work with us, we will just include you in our team. We want to mentor as many people as possible, but for now, the applications are closed. Maybe next year when we open the applications and then anybody is interested, the person can just apply and then we'll go through the process.
Interesting. So, of course, I know all these criteria need to come in also because you have limited time for yourselves to be
Exactly.
able to mentor them. But I think I asked that initial question because, like you did mention, if you have the expertise, if you have somebody who has just completed degree, undergrad, and I mean, if you talk about expertise, of course, just the basic things. Does that mean those people do not have the chance? Because obviously they will not have the expertise to get in there. What sort
No,
of plans do you have for them?
when I talk about expertise, I'm not really talking about so much of research expertise. So we look at basic issues because everybody at the undergrad level may have engaged in projects. So before
Okay.
you completed, you would have done project work. So for
Okay.
instance, if we ask you to share your experience in terms of the project that you did, at least we can talk about issues. This was my objective. This was how
Okay.
I did my research. This was how I collected my data. These are the basic issues that we look out for. But if at the end of the day you did your bachelor's degree and then you don't really have so much any knowledge at all on research, then it will be very difficult for us to bring you in because at the end of the day, even though the purpose is to mentor, but at least we have to get people with the basic standards of research.
Okay.
Knowledge, just the basic knowledge. It doesn't matter. You don't have to be an analyst. You don't have to be a methodologist. You just have to have the basic knowledge about research, and then you are good to go. We can really help you to build on whatever knowledge you already have.
Fantastic, right? I know we've overshot our time. I'm going to read some of the messages to you and I'll come back to you for your final words. But please pass my message to Aziz that he definitely needs to come here as well. Um,
You come.
so please pass it on to him. So Asabi says, I'm watching you live from Asante Bekwai. And here the same person says, Professor Ahinkorah is my brother. Thank you, Asabi, for watching. Richard Marfo says, watching from KNUST. Keyboard president, that is Joshua Otre. Joshua says the prof himself, go higher, bright. Tim Larry said, I'm loving this, prof. Precious, thank you for this one. Thank you, Tim, for watching. David Jarasa says, Prof. William Jemfi says, Prof. Ahinkorah, serious man with ideas. Wash hands, wash hands, wash hands. I'm not sure what that means, but I'm sure perhaps you understand him. William Jemfi again said, this is your boy Kofi Tufo. Um, well, Asabi again says, big brain professor. Tim Larry says, great one again. Please, can I gain a scholarship to do my master's or master of public health in the UK whilst working as an overseas nurse there? I know today we're talking about Australia, but briefly, I usually advise people that it's better for you to get a scholarship to come here, and then whilst here, you go through your nursing registration process. Because once you are here and working fully on tier two visa or working visa, it's very difficult for you to get a scholarship. But if you come here on scholarship, then before you complete, you would have gone through your nursing registration, and right afterwards you can work. So that would be my simple answer to you. Mercy Suman says, Professor Bright, more wisdom. Vivian Nkrumah says, my professor, my husband with big brains. Idris Salifu says, my man that oh. David Jasa again says, very insightful. Mercy Suman says, congratulations, Prof. Ishmael Kuka says, oh, are you ending the program so soon? Ishmael, we've already gone beyond our time. Patricia Smart Asari says, well done, bro. Keep making us proud. Mom is also watching with great joy. I'm thinking that's your mom. Regards to her. James Buedu Frimpong says, Prof, that's my professor in that. Wow, quite a lot of message. David Dresser says, Aziz and Bright are inspiration to us, the young ones. God bless them. Ishmael Kuka said, great submission. Emmanuel Asamoah says, watching you from Winnipeg. This is Kweku Ewe's brother. So I'll end here and I'll ask you for your final words. Right. Or if there's anything, just take 1 to 2 minutes. If there's anything really, I know you would have loved to, of course, talk about child marriages and all that, but take 1 to 2 minutes to highlight anything you want to talk about, or if any final words, 2 minutes
Yeah,
maximum.
thank you so much. I wouldn't bother our listeners with a lot of research, a lot of issues. I think I would take this opportunity to thank my family and then friends, my mom, my sister, and then anybody that is watching. I have to also thank my wife because she has really prepared me through this really interview. We started rehearsing this. She made the arrangements of the place and all that, what I'll
Wow,
wear for today and all that. She has done tremendously well.
too
And I think
fantastic.
I really appreciate whatever she has done for me. I thank her so much. And I have to also thank all my friends that are watching. I have to thank Abdulaziz wherever he is, John Kwesia Samoa, everybody that is watching, my mentees, everybody that spent the time to watch, and everybody that spent the opportunity or had the opportunity to watch us. I thank everybody. And I have to also thank Precious and your team for giving me this opportunity. I know that whenever I am called on, I would be very grateful to share other experiences that I have. Because of time, I know there are a lot of things we wouldn't have been able to talk about, but there will
That's
be
right.
other opportunities for us to talk about this. So thank you so much for the time, and then God bless you for everything.
Thank you, right. Tarif Salihu says Prof. Ahinkorah, and one evidence I'll be ending with here. Angelina Obin says Prof. Ahinkorah made research simple for me in Cape Coast Nursing and Midwifery Training College. Congratulations, Prof. So that is a very beautiful one to end on that. Thank you very much, Brad. It's been a very exciting, inspirational, interview, and I personally have learned a lot. Of course, people choose different things, but one of the things that really stand out for me is that I get very motivated by your publication, obviously because I'm in academia and it's one of our currencies. So I get very motivated by your publications, but it's quite instructive to know that you started from a point, and even at the time you are applying for PhD, you just had three, and within a space of 3 years, massive publications. And I've learned one or two things from you, like you did mention it's not necessarily partnering only with those who are already, on top, but getting connected with also those who have the passion and all that. Like I said, people will learn different things from this interview, but we want to say a very big thank you on behalf of myself, Precious Adadidudu, and also James Opon, who is the producer for this show, I want to say a very big thank you to you and your wife. We are grateful. Extend my regards to Aziz, and please let him know that I will need him on this show very soon. So thank you very much, Bright. And viewers, this is all time will allow us. In fact, we've gone over our time, but we want to believe this is a special edition. And I'm particularly interested and very excited to know that we have quite a lot of people watching, even though we've really gone beyond our time. It shows that you are really interested, you are learning something from this platform, and we want to encourage you to subscribe here on YouTube, Facebook, Instagram, and Twitter. Wherever you go, the name is The Discovery Show TDS TV. Comment, like, share, subscribe, and if you do that, all it tells us is that despite our busy schedules, you people appreciate the little we are doing, and therefore you want us to do more. It's a way to communicate to us. You can also contact us on our social media handles, and when we can, we'll definitely respond to that. If you know anyone you would love to hear speak on this platform, please recommend the person to us. We'll be happy to contact the person and bring the person on this platform, whichever field at all. So thank you for spending your time, your data, and for being here. And obviously, we will see you some other time very soon. So, Brian, thank you. And viewers, thanks again for being here. Stay blessed, take care of yourself, and have a lovely week.
Thank you. Thank you, Precious.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermine me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Perry Precious. Executive Producer, James.